Hello, I'm going to be talking about strategic management in healthcare systems. This is my third time recording this, so hopefully this actually works this time. So to begin, the philosophy behind strategic management has a myriad of benefits that range from improving financial well-being to providing the organization with a clear self-concept, goals, and guidance, while also providing consistency in decision-making. The main philosophy behind strategic management relies on everyone in the organization having the same attitude, an external orientation, and a concern for the big picture. So basically, if everyone's on the same page of what the goals of the company are, and that has been clearly explained to everyone, then that's how the company is going to end up succeeding. So this promotes coordination within the organization and leads to less confusion over what's expected of certain individuals or positions. The managers should have the tools necessary to recognize and respond to anything that could signal change for the organization. One of these tools is going to be the ability to communicate clearly with the people above and below them in the chain of command. So a manager basically should be able to know what's going on within her organization while also being aware of other things outside the organization, such as new legislation, supply chain, what the current hiring standards are, things like that, and then being able to communicate that to everyone else on her team. So healthcare organizations have to have a chain of command in order to ensure that patients are being seen by the most appropriate and trained individuals. Nurses have to report to their charge nurse, and then the doctor in charge of their patient, while the doctor will ultimately have to answer to those in an organization's administration. When all of these individuals work on a patient's care and they're on the same page, this ensures that the best care is being delivered. So basically, if the doctors and nurses are all listening to each other, they can potentially catch mistakes. They are ensuring that the best care, there's continuity between care. If you've ever been in a hospital before, you don't want to have to keep explaining to the nurse every 12 hours why you're there, what's going on. But if they're listening to each other and they're talking, then that can be eliminated, or at least reduced. Now moving on to financials. The financial well-being of an organization is also about being able to improve when the organization operates under this philosophy. When everyone's on the same page, things should flow smoothly, which allows for the most efficient use of the resources available. There's a study of the Harvard Business Review where 7 out of 8 companies out of a sample of almost 2,000 companies failed to achieve profitable growth when they didn't have a strategic management plan. But the companies who were able to create a strategic management plan were then able to create the growth that they needed to survive and then eventually thrive, because they were able to get their spending under control. They were eliminating spending on things that were unnecessary, or departments that were trying to accomplish the same thing but weren't talking to each other are finally talking to each other. So a lot of that overhead was reduced and people are able to get the things that they want done. So I have another healthcare example. Ideally, there's not going to be any unnecessary tests or procedures performed on patients, but we do know that sometimes this can happen unintentionally. Medicine will not be overprescribed to those who don't actually need it. So instead of giving antibiotics out to anyone who asks for them, waiting to see if it's something that can be cleared on their own, making sure that the medicines being prescribed actually work well with each other, things like that. When the patients are treated efficiently and effectively, they can head out the door quickly, allowing for more patients to be seen and treated. This turnaround is going to generate a higher profit for the organization. While the main focus behind healthcare should be about providing the best healthcare possible, money at the end of the day is an important factor, and it's what keeps the doors open. So it's not something that can be ignored. But when a system is operating efficiently, this is something that's not going to be too much of a roadblock to potential patients when they're deciding where to receive medical treatment or intervention. So if they know that they're not going to be charged for medicine that they don't need, or have all of these fancy tests done on them that aren't actually providing any answers, that can allow them to go into treatment with confidence. Now moving on to strategic plan, the different levels of it. So strategic thinking consists of the states of awareness, anticipation, analysis, interpretation, synthesis, and reflection. Now these often can occur out of this order. So you might become aware of something, but then you're going to start trying to analyze what the situation is, what you want to do with it, figure out what that means for the company, and so on and so forth. So this focuses on asking people to think about the big picture. An effective leader, like I was saying earlier, will be able to be both involved in this and while also being able to take a step back to better understand what's happening in the world that will affect our organization. So again, knowing things like if there's legislation involved, that if they're a private clinic or a smaller clinic that relies on funding, what the budget is in Congress that's going to be allotted to them, or if the price of insulin's going up, what that's going to mean for her patients that are coming in, or other things like if there's not a lot of people who are applying for these positions, what she can do to get the word out and get the right people into these jobs. So it's a lot of juggling, but ultimately it will pay off in the long run. Strategic planning is the process of developing a set of steps for an organization so that it's able to accomplish its mission and vision while using strategic thinking. So this is going to create a step-by-step process that allows companies to create their strategies. Data gathering is an important part of this process. So doing surveys on what's working well, what's not, what the needs of the patients are, things like that. What's being used, what's not being used. But it also involves group strategic thinking that allows for voices to be heard within the organization. So having the CEO sit down with a group of doctors, nurses, pharmacists, the front desk people, medical assistants, a range like from the bottom of the hierarchy to the very top, having everyone in the same room sitting and talking about what they see that's working well, what could use improvement, and what they think that the big picture should be for the company. So this is going to help to establish focus as employees are able to help shape the direction of the organization. Those involved in the decision-making process will be able to reach a consensus on what is best for the company in regards to responding to the external environment. All of these steps are going to eventually result in a documented strategic plan. Something else that's not mentioned here is when people feel like their voices are being heard and valued, then they're more likely to stick around and see this kind of stuff through. They know that the people at the top are listening to them, they value their opinions, so they want to help out. But if you're in a place that doesn't value you, you're much more likely to move on, and then that's going to end up hurting the patients who have to stay with that clinic. So doing this kind of stuff, even if you don't think that your organization needs to be restructured or what have you, checking in with people is an important part of keeping morale up, keeping people happy. So moving on to strategic momentum. The daily activities need to achieve the stated strategic goals are part of strategic momentum. It's the work that goes into making sure that these specific objectives are being achieved. It's a learning process and will adapt as things progress within the company. It also provides the evaluation of the strategy. It provides the style and culture of the organization, and when organizations have good cultures that encourage people to work well with each other, the results of the organization will speak for themselves. So like I was saying, if people feel valued, they feel like their ideas are being heard and then implemented, they're going to want to stick around, they're going to want to see this through, they feel like they're stakeholders in it, which is a really important part, and that's going to help keep these things moving, keep things going, and then ultimately achieve the goals for the company. So moving on to my conclusion, final thoughts. The ultimate responsibility of strategic management is going to be left up to upper management such as the CEO. She needs to be constantly evaluating the needs of the organization and the external environment. She is in charge, but needs to be able to clearly and efficiently communicate her expectations to lower management and then ultimately the entire organization. Strategic management has many benefits that allow companies to make the most of their resources and employees. So my final question is, if you could put in the discussion post or however we're going to be doing this, if you have any real life examples of this strategy working, not working, and if it didn't work, things that you would have done differently, and this could be something either at school or if you work in a clinic, you had an internship somewhere. Just want to hear your real life applications to this. Thanks.